Skin manifestations are one of the commonest changes in thyroid dysfunction, be it hypothyroidism, hyperthyroidism, or autoimmune thyroid dysfunction. In this episode, let us try to understand what are the common changes that happens in each one of these conditions and what can be done practically so as to reverse and cure the condition. In hypothyroidism, it is observed that the patients usually have a dry, rough, cool skin, whereas in hyperthyroidism, there is warm, moist, baby-like extremely soft skin. Both of these are not normal. In hypothyroidism, it is a condition called hypohidrosis, as in there is decreased functioning of the sebaceous glands, more like it is atrophied, and therefore the sebum secretion is reduced. And this is what leads to dry, rough, cool skin. The cool skin is also because the overall temperature or the overall rate of metabolism in hypothyroidism is reduced. Now, so as to maintain the core temperature, the body as a whole is trying to prevent the excess exothermic reactions so that the core temperature can be maintained. Ayurvedically understood, there is a certain layer of Pitta Kapha Vriddhi happening between the skin and the muscle. To be more precise, it is between the Tvak and Mamsa. This often happens because of excessive consumption of spicy, sour, salty food over a prolonged period paired with heavy, creamy, cheesy, greasy food, both of which leads to excessive Pitta Kapha imbalance. And once there is an accumulation of this layer driven by the Vata spike like late nights, excessive exertion, excessive exercise, and this leads to reduced capillary supply on the outermost layer of the skin. Now, under such circumstances, you must have observed that just by the application of a moisturizer or abhyanga, which is oil application, it doesn't really take care of the dryness. So then what can be practically done? We need to understand that it is because of the accumulation of this particular layer, and that exactly is what needs to be treated. So when we treat the patient Ayurvedically, before administering oil application, we ask the patients to get their gut corrected, which is the gut-brain axis, through which there is also correction of the thyroid gland. Once the core metabolism is corrected, then the first formed tissue, which is a rasadhatu, also gets properly formed. This leads to the proper nourishment of the Tvak or the skin. And also we try to get rid of these accumulants in between skin and muscle. So that is about hypothyroidism. In case of hyperthyroidism, there is a condition called hyperhidrosis, wherein there is excessive exothermic reaction, wherein the core temperature is highly raised, because of which the same effect of Pitta is felt on the skin in the form of excessive warmth, excessive moisture. Now, once we treat the internal metabolism, then the Pitta reduces along with the Vata, and thereby the normal skin health and excessive sweating can be brought down. If you are a hypothyroidic patient and if your doctor has increased the dosage of your synthetic thyroid pill disproportionate to the requirement of your body, that can also lead to night sweats or excessive sweating. Now, coming to autoimmune conditions like Hashimoto's thyroiditis and Graves' disease. Being autoimmune condition, it not just affects the thyroid gland, but it can also affect the rest of your part of your body eventually because of the same autoimmune reaction. It can be in the form of eczema, urticaria, SLE, psoriasis, or even vitiligo. Now, the core treatment for the same Ayurvedically is the same. One, to understand what is the cause for this autoimmune reaction. Two, stabilize the fight-flight response of the body and to bring down the stress. And three, treat the specific skin condition. Once that is done, the results are almost always promising. Now that you know that these are the changes that happens in each one of the conditions, let me know in comments which one are you specifically struggling with and what has helped you overcome the same.